So I'm Nancy Munson. I'm the Chief Executive Officer of Bristol Elder Services, and I really want to thank you all for being here today. Many of you know us as the agency that's designated by the Commonwealth as the Aging Services Access Point here in Greater Attleboro, Greater Fall River, and Greater Taunton areas. Today we're branching out to something that's a little bit different, and I want to thank you all for taking time from your hectic schedules to be here today. I think so many of the key stakeholders from the city coming today shows the interest that you do have in helping us make Fall River a dementia-friendly community. We have this opportunity to really help all of the residents and to be a trendsetter in Massachusetts. We chose Fall River for a couple reasons. One is that it is the place, it's the biggest city that we have in our service area, so it gives us the most people to reach. Secondly, we know that Fall River is designated as a healthy city, so we know that they've been working on healthy living. The third reason almost seems contradictory in that the city has a number of the high risk factors that contribute to dementia, such as heart disease, heart disease and diabetes. We also know that Fall River, from working here, all of us, we know that it's really a city that has great organizational collaboration. As we look around, and it's a lot of Old Home Week today, some of us have been working together for many, many years. So as you look around the room, you can see that we've gathered many of the community leaders, those of you who are citizens, who are the community leaders, who are caregivers, who are other stakeholders. We've brought together the public, the private sector. We've brought together nonprofits. You know that the number of elders who are affected by Alzheimer's disease is staggering, and the number continues to grow. There are many people who are also under the age of 60 who are affected by dementia. And that means that there are thousands of people in their little circle of family, friends, neighbors, and coworkers who are also affected by the disease. We're here to learn today about what you, the people in the city, think that we can do to create a dementia-friendly community. As each part of the community works together to becoming dementia-friendly, it sort of branches out. The community becomes safe, respected, and informed. And it creates a quality of life for those who are affected with dementia. Those who have dementia describe a dementia-friendly community as one where they can find their way around the place, where they can go to banks, pharmacies, restaurants, stores, post offices, the Y, where they're known and where they are familiar. They can maintain their social contacts so that they can continue to live in the community in which they've known. So our goal today is to really gauge the interest and see if we can come up with some activities and some people who are willing to move forward with this. You'll notice that on the table there are some count me in cards that we hope by the end of the day, the end of the morning, having heard about what's going on in other places and what could be going on here, you'll be willing to sign that card that either you or someone from your organization is ready and willing to keep working on this project. I'm really pleased to have here today Secretary Alice Bonner.
So we have been going all around the state in different cities and towns. I was just telling Nancy that last night in Westboro, which is where I live, not Westport, but Westboro, we're just starting to kick off Dementia Friendly. So it's really interesting for me, having been in lots of cities and towns, to now be in my own town and see what does it really take on the front lines to get this going, and why is it so important. People generally come to groups like this because they've had a personal story. They've got, this impacts their life in some way that's very personal. And you may have heard Governor Baker talk about his mother who had Alzheimer's and, for about 10 years, and spent the last few years of her life in a nursing home, and kind of what it meant to his dad, what it meant to him and their family. And so we have someone right now who's our governor who really understands this and cares deeply about this issue of Alzheimer's disease and dementia. So both at the state level and at the local municipal level, there is an opportunity for us to come together and say, the Commonwealth of Massachusetts will not tolerate the stigma around dementia, will not tolerate, having people with dementia only able to live in nursing homes, which is back in late 1970s when I started as a nursing assistant in nursing homes. Remember, almost everybody who had dementia was living in nursing homes then. And now, because we're a community-first state, we have lots of people with dementia and their caregivers living in the community, in their own home, in assisted living, in public housing. And so we have to figure out how to support people with dementia in our communities. What is it going to take for those individuals to feel engaged and part of the community and valued? Some of this is about funding, I guess, but a lot of it is not. A lot of this is about grassroots community organizing, that all of you came here today because you're thinking about this. And some of the things that we do for older adults with dementia don't necessarily cost a lot of money. Some of it is training. We have the Alzheimer's Association that's training 10,000 police officers through local municipal grants with public safety, and moving on and also training firefighters and EMTs, first responders and others. And so that's a collaboration. Those trainings do not cost anything. They're through a grant. So a lot of the work that has been going on and will continue to go on is supported either through grant dollars, through local philanthropy, and through a lot of volunteer efforts. I know, through our ASAP network, Bristol Elder Services and others, they operate with lots and lots of volunteers, and particularly our family support program for caregivers is a program that has lots and lots of volunteers in all of your cities and towns. So we can come together, we can think about this. It resonates for almost everyone. It's got special meaning for me because my mother is 86 and she lives in Massachusetts and she has Alzheimer's. We're very fortunate that she is able to still live in her community. She lives in Northampton. And I'm learning as a caregiver, I'm out there every weekend, and we have our little routine. We go around, we go to the bank, we get money from the bank. My mother can't speak anymore. She has no speech that you can understand. She has no words. So she goes up to the bank teller and she says, 3, the same as last time, 3, I need 3. So if you're the bank teller, what do you do with that? You could say, you could lose your patience really quickly. Or at my mother's bank, which is a local bank, and they're wonderful, and they know her, you could say, oh, hello, Joan, you were here last week. Do you need $300, and would you like 20s? Because they know that's what, she's asking. So that bank is a great example of what Dementia Friendly Massachusetts is about. Local institutions, banks, financial institutions, public safety, healthcare, every aspect, every sector of what we call a community, knowing and understanding what Alzheimer's and dementia looks like, what it means when an older person comes in, or a person in their 50s who might be early onset, right? But when someone comes in and has certain behavior or certain ways that they talk, that the person doesn't lose patience right away and assume that they've got sort of an evil personality, but that they actually think to themselves, because they've been trained and thought about this, oh, maybe this person has dementia. When my mother, who is a lovely person and very, very polite her entire life, when she goes to a restaurant now, she's very impatient. It's part of the disease process. She has a lot of anxiety. She will not wait. So if the service is a little slow, she goes like this. She would be horrified if she could process intellectually and think that she was doing that. She would be horrified. And again, the servers, I choose the restaurants with her when we go out to lunch, where I know the servers know us and also will be patient and will not take offense to that. So we've got a few places where we go where she walks in and the person who owns the restaurant comes up and gives her a big hug and says hello and how nice to see you. That's what Dementia Friendly is about. It's really about those human connections and those relationships. So Fall River has people like all of you who care about those things, and you can create in your community the ability for people with dementia and their caregivers to be engaged and feel valued and to really thrive together. And it's a great thing to come together around, because just like coming together around our kids and our schools and our parks, it's a community activity that lets people feel good about, how you work together for everybody in your community. So, just to let you know, again, at Elder Affairs, our mission and our vision lead us to our values. And if you look at our values here, we value the contributions that older adults and individuals with disability make to society. We value a person-centered approach, and we value collaboration with our partners. And we say this across all of our programs and services, but it really hits home, I think, with Dementia Friendly and the work. You have, and you're going to hear about lots of statistics today, both the national statistics that we have on the left, 5 million people in the U.S. with Alzheimer's, and the statistics here in Massachusetts. So again, about 125,000 people already diagnosed. We know many people are not yet diagnosed but have the disease. And keep in mind and think about the younger onset folks who are very small in number, maybe only about 200 people in our state, but really have a lot of very unique needs. Dementia is one of the most expensive conditions when we look at hospital costs, readmissions, and other healthcare costs. Some of you might have seen in the newspapers the HPC, Health Policy Commission, met yesterday and was talking about cost trends. Again, dementia is a very expensive illness over time. So an opportunity not just to think of the human aspect of this, but costs as well. So Dementia Friendly, as I mentioned, is this idea of bringing all different sectors together, faith-based organizations, your public schools, principals and teachers who can work with middle schoolers and get them thinking about dementia. What does that mean? Very big role for public safety and a huge role for our legislators and public officials to be able to say in our cities and towns, what can we do to really move forward and make our cities and towns dementia friendly. And Massachusetts is a leader in this work. There are 31 cities and towns right now that are coming together, and more all the time. So again, I know Nancy and others are going to talk to you today about what dementia friendly means. It's not something that has an end point where you would say, yesterday we were not dementia friendly, but today we are. Now we can go home. It's not like that. It's an ongoing initiative where we're continuously trying to get better and better at the programs and services and the ways that we approach people with dementia in our community. It's about being inclusive and, again, getting rid of the stigma. So we want to be efficient across the Commonwealth. We want to make sure communities are inclusive, and we want to be able to scale this. So we're at 31 cities and towns already. We have 351. So we're getting there, but we have a ways to go. But with you guys getting on board, that will be awesome. We started out with a summit in May. We had a lot of people come. We brought people here from Minnesota. Minnesota has Act on Alzheimer's, which has been the first state to really get out there with lots of cities and towns and make their communities dementia friendly. We have a large advisory group, which is a wonderful group. We have individuals who have mild early Alzheimer's who serve on the group, the Alzheimer's Association, many other partners. And we have these learning communities. And what that means is that while you guys are doing your work in Fall River, you might get together on the phone with people who are doing work in Springfield or Worcester or other parts of the state, so that if you're trying to help the pharmacists or the grocers or the hairdressers in Fall River and help train them and sensitize them to people with dementia, you can learn from other cities and towns that are already doing that work. So again, this is just some background. I'll make sure that Nancy has the slides and can give them out to anybody today. I don't want to take up too much of the time with the basics, but I do want to show you that the Dementia Friendly America folks have a really great website. And it's terrific because they've done the work for us, and they already have the tools for communities to assess the needs in the beginning of what you want to do. How many people with dementia do we have? How many caregivers? Who else might come to the table? And it walks you through how to assess your community, figure out the needs, and get started. It also has these sector-based toolkits. So again, the needs that I have in the restaurant or hospitality industry might be different from gas station attendants. And if you think about it, you might say, why is she talking about gas station attendants? Think about somebody with dementia who gets confused and decides to take off and leave Westport or leave Fall River. That person is going to stop at a gas station. They might ask directions because they are confused. If you train gas station attendants to be aware, they might actually prevent somebody from getting into a dangerous situation and leaving their hometown. So things like that. But each of these sectors has their own guide. So you don't have to invent this, it's already been done. These are all the different sectors and communities. We've talked about them, faith-based organizations, restaurants, banks, etc. And this all-sector approach really lets you make sure everybody's kind of at the table. The guides that are here, again, this is the one for financial services, and it says prepare, learn, respond, full of great information. So all you have to do is go to the website. The community toolkit will help walk Fall River through the different phases. And again, Nancy and I have a wonderful colleague, Christine Alessandro. She is the director of the Aging Service Access Point in Marlborough. And she's already done this in Marlborough and Hudson and Northborough. So she's a little bit ahead of some of the other communities, and she's been going around the state and helping people identify the challenges, the barriers, what's worked, best practices. So we've got folks who can help walk through these, but it's about convening, engaging people, analyzing the data from your assessment, and then forming these action teams. And sounds like you guys are going to talk about that more today. So Fall River is already an age-friendly community or a livable community. And that's a designation that says in addition to dementia, we value older adults and we want to create a positive environment around public spaces, around volunteer opportunities, employment, information, healthcare. You're addressing all of those different things as an age-friendly community. A lot of people have said, well, how does that sort of dovetail with dementia friendly? And AARP, our colleagues there, did a wonderful report that talks about age friendly and dementia friendly and where they overlap in a positive way and kind of align and where they build on one another. So if you have questions about that, this report is really helpful. This is the Dementia Friendly America website. And again, in the handout, it goes over the key lessons from the summit. And we talked about these learning communities, which I think when you break into your breakout sessions this morning, you know, you might want to think about who could be in these learning communities, who else, what other resources do we have here in the Fall River area? You may have folks at UMass Dartmouth who specialize in aging. You may have other colleges and universities, community colleges, schools of nursing, schools of social work, lots of opportunities to bring people together in these learning communities. This is the age-friendly rubric I was just talking about. Again, I know you guys are familiar with it because you've been working on age-friendly, which is a great foundation for doing the dementia-friendly work as well. So I know that you're going to be hearing today about what you can do next, and I just want to say on behalf of Governor Baker and Secretary Mary Lou Sutters, how much we appreciate that you've come together as a community, that you're thinking about this. Elder Affairs does have some resources, and both in our support of Nancy and her wonderful team and her leadership, but also from our office in Boston, if there are ways that we can support what you want to do, provide connections, help network, and things like that. We've been doing that around the state, and our team does come out to different communities, so we'd be happy to come down here again and connect with you as you move forward. So I just wanted to take a moment to stop. I know I talk really fast. I'm from New York, I'm sorry. Plus I only had 15 minutes, so I'm not sure how long I talked for. But do you have questions for me? I'm going to listen for the next 45 minutes or so to the rest of the program. But any thoughts or comments? Yes, sir.
Do you ever present to like chambers of commerce?
Great question. So I'm going to repeat the question. Do we ever present to chambers of commerce? Yes, we love that. And it's a really good point because the business community is absolutely critical. We also present to the Mass Municipal Associations. I've spoken a couple of times at the mayor's conferences. We do a lot of presentations to legislators. So if you have, if you would like us to come down and somebody from our team talk to the chamber, we'd love to do that. Thank you. Other questions? You guys excited about this? This is the fun stuff. After I leave here, I have to go back to the budget talks, okay? So this is the fun stuff that we get to do. Anyway, I really, really, truly want to thank you. I think this will be a wonderful initiative. Nancy will talk about it. It needs to be something that you do believe you want to do more than all the other things. We want to fix our roads. We want to improve our schools. We want to, help, with unemployment. These are all important things. Fall River needs to decide what is really important to you as a community, and is Dementia Friendly something that you feel like you want to be working on right now? And I hope that it is. So thank you very much.